Hello, everybody. This is, as you know, Brother Malik Heru, el-shabbazz, with another uh, iteration of my herbal opinion. And the opinion today is coronavirus. That is the discussion of the day. And what I want to do is I want to kind of jump right into the situation. And the situation is a cure or prevention. Now, everybody's washing their hands now, which is good. It's a little too late, but it's still a good thing. And I hope that people continue on that trend, washing their hands and have an improved hygiene protocol in place. Whether it's washing your hands, washing your mouth, taking a bath, when it comes to sex, whatever they need to do hygienically, I hope that they have made improvements. I hope people have made improvements on a whole. So, I'm not a doctor, so I'm not going to sit here and say that what I'm about to tell you is a cure, because it's not a cure. But what I'm about to tell you is more of a preventative measure, a preventative approach to avoid having to experience coronavirus in the first place. So, there are four main ingredients for this particular infection that I want to talk about. And the four things that I want to talk about is astragalus, mullein, elderberry, and skullcap. These are the four main herbs that I want to talk about, because these four herbs work with the affected area where coronavirus finds itself in the end, which is in your lungs. Now, I believe that coronavirus is more of a upper respiratory infection, an aggressive upper respiratory infection, a variant of the flu. And it is so aggressive that it will prove fatal in some people. In other people, it'll prove to be a real nightmare health-wise. So, I want to get started here. I'm going to talk about skullcap. I don't know if you can see that. This is a green herb when it's powdered, and it is the I'm working with the leaf. I'm working with the elderberry, and these names that I've got on these bottles don't really mean anything to you, but I'm just letting you know that this is what I'm working with: astragalus, and of course mullein. So I want to describe each one of these herbs, and I'm going to be reading from them, and then I'll be discussing each one of them. So astragalus first. Astragalus has been used in traditional medicine for centuries. Its main use has been to boost the body's immune system, but it also has been used to treat other conditions, including heart disease. Astragalus is a natural dietary supplement that's used for various health conditions. For instance, it's used to treat the common cold, upper respiratory infections, fibromyalgia, and diabetes. Some proponents of astragalus use it for its possible heart benefits. They claim it may protect against heart disease. It's also used to help improve overall weakness. Proponents also say astragalus stimulates the spleen, liver, lungs, circulatory, and urinary system. It's also used to treat osteoarthritis, asthma, and nervous conditions, as well as to lower blood sugar and blood pressure. Now, with all of that being said, of course, the medical professionals always like to say that there's limited evidence to prove that this is effective for all of the things that it's said that this particular herb treats. But I have to also add that astragalus has also been tested for breast cancer, the common cold, hepatitis, and lung cancer. So astragalus is a really potent herb, especially in this case, because it will go into the area where the virus wants to live, and prevent or strengthen or reinforce the that immune system, so that virus can't live in that environment. Okay, the next one is the skull cap. Now, I kind of it's different names for the scientific names for these herbs, but the common name is the names that, if you want to make this for yourself, these are the names that you would look for: the astragalus, skull cap, mullein, and elderberry. Anyway, again, skull cap is a Chinese herb, or used by the Chinese, and it is native to several countries, as well as Russia. The dried roots of this plant have been used for centuries as a traditional Chinese medicine known as Wang Qin, to treat diarrhea, insomnia, dysentery, high blood pressure, hemorrhaging, respiratory infections, and inflammation. In alternative medicine, skull cap is sometimes recommended for the following: inflammation, insomnia, hepatitis, epilepsy, arteriosclerosis, cancer. The health benefits of skull cap is it relieves anxiety, reduces pain, soothes the nervous system, removes toxins, manages diabetes, heart health, weight loss, and antibacterial and antiviral effects. So already these two herbs together are proven to be a powerful team to combat or to reinforce or strengthen the lung area. Now, if you have these following ailments, then you probably shouldn't wouldn't want to use the this particular herb, skullcap. Sorry, I'm looking at the words here, and I'm kind of. That's why I like to go straight from the head, because when I'm reading, then I'm focusing on this as opposed to looking straight at this. But if you have anticonvulsants such as phenytoin and valproic acid, depakote, barbiturates, benzodiazepines such as alprolizam, I fucked that up, alprazolam or Xanax, and diazepam, Valiums. Drugs that treat insomnia such as Ambien, Sonata, Lunesta, and Rosarim. Also, if you are taking tricyclic antidepressants such as Elavil, you probably don't want to use this skull cap. Now, again, if you have a doctor that you trust, then what I would do is I would just take these notes and ask your doctor about possible. So here's the thing about pharmaceuticals and natural remedies. The pharmaceuticals are powerful components that turn on and turn off aspects of the target, so that you can not have the symptoms that come with the situation. When it comes to, but sometimes those pharmaceuticals don't do everything that you need it to do. So it's becomes a good idea for you to have a supplement or a basically a supplement, an herbal supplement that will complement the pharmaceuticals. And so in this case, while you might be taking barbiturates, or you might be taking Lunesta or something like that, if you speak to your doctor and say, hey doc, I'm interested in taking these particular herbs. Now some doctors, they don't get much training in when it comes to natural remedies, but some doctors are educated enough to know enough to give you a good opinion and say, well, that particular herb will probably help you more than it will hurt you. So, take it or don't take it, or so on and so forth. But if I were you, talk to a doctor and somebody that you've been dealing with, and not just somebody off the street, but somebody you've been dealing with who know you, and let them give you an opinion on these complementary herbs. And I hate to say complementary alternative medications, because in my opinion, I am a strong supporter of herbs before pharmaceuticals. But I believe in people taking care of their quality of life. And if the pharmaceutical is going to help you, by all means take the pharmaceutical. I'm not one of those fundamentalists who go, don't take the pharmaceutical at all, to the point to where you are where you die or something like that. If the pharmaceutical is going to sustain you, then you do that. What I will say is, while you are taking the pharmaceutical, you have to make an adjustment to your lifestyle so that over time you won't need the pharmaceutical. You can be independent of that need, and instead, um, start using the herb as a primary alternative. Now, mullein is the next herb. Now, mullein is one of those herbs, man, that is it's a badass herb, and I am a particular fan of mullein because of everything that it does. And if you are a smoker, you might want to consider using mullein versus a cigarette or a cigar or tobacco. Anything with nicotine, you want to replace your nicotine with mullein. Mullein will not only give you the feel, the smoothness of a cigarette or a cigar, but it will also help you internally, whereas a cigarette and a cigar won't. And for instance, the chemicals in mullein might be able to fight influenza and herpes viruses and some bacteria that cause respiratory infections. That is enough for me to go, I like that. So let me back up. So far, we have astragalus, we have skullcap, and we have mullein. And all three of these herbs are proving to be excellent proponents or excellent units for the respiratory system. So mullein is used for cough, whooping cough, tuberculosis, bronchitis, hoarseness, pneumonia, earaches, colds, chills, flu, swine flu, fever, allergies, tonsillitis, and sore throat. That by itself, mullein by itself, seems like it can take care of corona by itself. But when it comes to something like a virus, like that's as aggressive as corona is proven to be, you want to be able to, let's say you have 4 tires. You already know this analogy, but I'm going to say it anyway. You have 4 tires, and one of those tires is you have 4 bad tires, and you can only afford to buy 1 good tire. So you buy a new tire. Those 3 tires are going to wear out or overwork that good tire until that good tire is just like the bad tires. So when you have an aggressive situation like corona, you want to be able to not only just attack it head on, you want to be able to attack it in every direction so that it don't have a place to escape or egress or mutate or anything like that. You want to get it, surround it, and close in on it and kill it until it's dead, and there's no way it can grow or mutate. So, but mullein has more health benefits than what I just named, so I'm going to name those off as well. Other uses include asthma, diarrhea, colic, gastrointestinal bleeding, migraines, joint pain, and gout. It is also used as a sedative and as a diuretic to increase urine output. Depending on how it's processed, whether it's a salve or a tonic or if you smoke it, it can be good for the following: wounds, hemorrhoids, colds, flu, asthma, diarrhea, migraines, gout, tuberculosis, cough, sore throat, inflammation of the airways, which is bronchitis, and other conditions. So in this case, I want to suggest using mullein, astragalus, skullcap, and elderberry as a smokable herb. And the reason why I want to use it as smoke, as something you smoke versus a capsule, is because of not only the herbs itself, but the smoke from the herbs is going to have that a faster and a more effective impact than the gradual taking of the capsules. Now, you can also make tinctures out of this particular blend, and you can take that tincture and put it under your tongue, and the tincture is going to be more concentrated than the capsules, but it's going to go into the liver and get processed through that business, and it's not going to be as effective as the smoke. The smoke is going to go straight to the lungs. So, in my opinion, take the smoking angle, and later, or for future reference, you might want to be able to take in consideration the tincture or the capsules. But for right now, in this situation, the smoking is going to be better. Now, the fourth herb is the elderberry. Now, most people are familiar with elderberry, more familiar with elderberry than they are with the astragalus and mullein and the skullcap. That's because grandmother, grandfather, the older people used to just go out and pick the elderberries and eat them off the tree, off the limb, and you go out to the shrub, you got a bunch of elderberries, you pick them, you eat them, and go on about your business. And older people didn't get sick as much or as often as we do today. That's a whole nother story. But anyway, elderberries are the dark purple fruit of the elderberry shrub, a rich source of antioxidants known as anthocyanins. Elderberry is reputed to some to be effective in treating the common cold, flu, constipation, hay fever, and sinus infections. Others contend that it may be useful in treating toothache, sciatica, and burns, among other things. If you're constipated, you can drink a tea made from elderberry and other ingredients. That seems to increase the number of stools passed in people who are constipated. So you take the elderberry, the more straight the elderberry, meaning unmixed, the better it's going to work for you. But some people take the elderberry because it's bitter, and they mix it with other stuff, or they convert it into a concoction like a syrup, which is how I use the elderberry that I sell. Is I make it into a syrup, and it's easier to take that way than it is to just chew them or whatever. Now, if you have the flu or influenza, A specific elderberry juice syrup seems to relieve flu symptoms and reduce the length of time the flu lasts when taken by mouth within 48 hours of the first symptoms. Taking elderberry lozenges, you know what I'm talking about, within 24 hours of the first symptom also seems to reduce flu symptoms. Relief seems to occur within 2 to 4 days of treatment for most people. Taking a product that contains elderberry juice and echinacea, I fucked that word up, man, also seems to relieve symptoms and reduce the length of time flus last. It seems to work similar to the prescription drug Tamiflu. So the medical professionals always, of course, they like to say, well, it hasn't been proven or scientifically proven for this or that, whatever, but people have said it is good for people with heart disease. Early research shows that taking elderberry extract daily for 12 weeks does not reduce risk factors for heart disease in postmenopausal women. Well, when you are postmenopausal and you are having these issues like grandma and great grandma, and they took that and they lived to be 90, 95, 100 years old, you know, that is proof enough. We know that elderberry is good for you, but does it help in these ways that people say that they work? I'll take the word of the elders over the medical professionals, because I always believe that the medical professionals have a medical agenda and a reason why they would mitigate taking an herb versus a pharmaceutical. So the common cold, early research shows that taking a specific type of elderberry extract for 10 days before and up to 5 days after arriving at an overseas travel destination does not prevent colds from developing. However, it does seem to shorten the duration of colds and reduce cold symptoms. High levels of cholesterol or other fats, lipids in the blood, hyperlipidemia. Early research shows that taking capsules containing dried elderberry 3 times daily for 2 weeks does not reduce cholesterol levels in people with high cholesterol. I don't know why I took notes on this. Why did I don't know why I did that, because this is denouncing more than it's helping. But I think that it's necessary to say what, to kind of dispel what some of these herbs are said to do and versus what they actually do. Now, again, history has shown that elderberry is one of those herbs that will knock out a cold or a flu. And coronavirus is a super cold, a super flu. And when you take the elderberry and you combine it with the other 3 herbs and you smoke that, those 4 herbs together will be able to take care of, in my opinion, it's going to be able to take care of your lungs so that it can be strong enough to reject the virus from entering into your and settling into your lungs. So I want to end this by saying that elderberry is also good for obesity, cancer, chronic fatigue, constipation, H1N1 or swine flu, HIV/AIDS, hay fever, headache, nerve pain, toothache, and other conditions. So I have, I like coming off the top of my head with these solutions more than coming off the paper. So I have basically, I think I taught myself something here today, whereas I don't think that I want to use the paper anymore. I'm going to just go from my head. I think that's better for me. But anyway, I'm not going to stop this video. I'm going to keep it going because I think it's important. At el-shabbazz Organics, I make this this solution. Either I can make it in a syrup, I can make it in an alcohol tincture, I can make it into a smokable herb, to a smokable format, so that you could. I don't have any with me, but I can make it to where you could just smoke it. Smoking it, the smoke is going to go straight to your lungs. It's going to spread through there, strengthen up, fortify what's going on in your lungs already. So let's say if you have asthma, then you're going to be more at risk of getting the coronavirus because you already have a weakened immune system. So if you have these herbs, those herbs will fortify your lung capacity or your lungs, so that if you are come in contact with somebody that's infected, you'll be better able to resist that transmission. So if you are interested in getting this this blend from me in any format, you know, you can always go to herbal.com. You can email me at malikheru@herbal.com. You can live chat with me on the website. Leave a message in the YouTube. Subscribe, and you can also give me a call. I don't mind if you call me. 832-267-4495, and I'll be happy to talk with you. If you send me an email, I'll get back with you. You can social media with me. I have a strong following on Facebook. Facebook, el-shabbazz Cosmetics, el-shabbazz Organics, el-shabbazz Naturals, Malik Heru el-shabbazz, and you'll find me, and we can talk. I hope that everybody stays safe. I hope that everybody stays smart. And the number one thing that I hope people do is avoid panic and fear and knee-jerk reactions to this situation, or any situation for that matter, because when you do that, you tend to make the wrong choices, and the wrong choices can only exacerbate the problem. When if you would have made an informed decision, or a critically thinking decision, or a decision based on critical thinking, you could have solved the problem. So, peace.